Well, then we are going to move on from this briefing. And I see that a lot of our city partners are starting to join us and a few of our state reps and senators. So thank you very much. So at this time, we're going to move into item 12B, which is our 4:30 vaccine distribution presentation. And I would just like to, at this point, thank all of our, our board members and our staff, but also our city partners and our state partners for joining us this afternoon. We know there are a lot of questions about vaccines, and we just wanted to bring everybody together so we all had the same answers and the same information. Today, we're going to be joined by Snohomish County Executive Dave Summers, Snohomish County Emergency Management Director Jason Biermann, and Snohomish Health District's Health Officer, Chris Spitters. They're all going to be here to provide you an update on vaccine distribution and prioritization in Snohomish County. So we are recording this meeting, and a transcript and materials will be available tomorrow on the Health District's webpage. This is www.snohd.org/COVID under news and briefings. If there's time at the end, we are going to be taking questions from the chat box, so you can submit those through the chat box. And we just really appreciate you guys being here and joining us today and being part of this solution. So we just want to make sure that everybody has all of this up-to-date information. And with that, I am going to turn it now over to Executive Summers.
Great. Well, thank you, Chair Wright. Good to see you all. Can you hear me okay? Yep. Okay. Well, good to see you again. First of all, I just want to really thank you all and tell you how much I appreciate the partnership we've had between Snohomish County and the Health District through the pandemic. Many residents don't realize that we're separate bodies of government, but very early on, we came together in the Emergency Coordination Center, our emergency management team and the Health District team, and we've been working really well together. And I think it's one of the reasons, at least in my view, we've been extremely effective and prepared as we go forward and coordinated. So I just want to say thank you, thank you, thank you. And also to the Board of Health members, I had the pleasure and honor of serving on the Board of Health for 14 years. And so I know the work you do and the importance of it. In addition, a little personal story, my mom worked for a health district down in California when I was growing up. So I very much appreciate public health and just think it's vitally important that we get this right. And I'm sure some of the concerns, I heard a few of the comments or questions about the state legislation. So we will be weighing in on that also, because it's absolutely critical we get it right. Public health is too important to mess up. So we also have really depended on partnerships with a lot of different entities and people across the community, including healthcare providers, faith leaders, nonprofits, private citizens. It's been, really a heartening effort in my view here in Snohomish County. So it's I'm really, really proud of the work everybody's done. We know, how difficult this has been for everybody, and since day one, our goals have really been to make sure our healthcare system was functioning properly and not overwhelmed, and we wanted to prevent deaths and also address the other negative impacts from the pandemic. And that included delivery of food to people in need, financial assistance to businesses, and rental assistance, et cetera, et cetera. So again, that was largely possible too because of the CARES Act dollars we got from the federal government. But I think we've delivered them quickly and efficiently out into the community, and we'll continue to do that, as we go forward. Just really trying to address the wide variety of impacts to the community. And so our latest goal and focus is really speeding the delivery of vaccines to as many people as quickly as we can. And our goal is to vaccinate everybody and get it done quickly. And so we're really, here today. One note, you probably mentioned this already. This is the 1-year anniversary of the discovery of COVID in our community, and we were the first out of the chute, but it was 1 year ago today. It's hard to imagine. Both seems like the time's going fast, and also seems like ages ago. So we'll confused about the whole thing, but you know, it's been quite a year. So vaccine delivery, I really want, and I'm going to turn the program over in a minute to Jason Biermann, but I just want to thank him. He's the head of, or director of my emergency management department at the county, and our emergency management department at the county. And he got the team together along with the team from the health district, and we really started planning for vaccine delivery in July. And as a result of that, we have stood up 3 rapid or mass delivery programs, one at Painfield, one down in Edmonds at Edmonds College, and one out in Monroe. I just saw a news clip that the Pierce County Council today voted $4 million of general fund to start to set up mass vaccination sites. We have 3 running and have the ability to stand up a number more. Our capacity currently, if we had the vaccine, is about 30,000 people per week. We could easily ramp up that capacity to 50,000 or more per week, but we just don't have enough vaccine. And Councilman Lowe, you asked about, heard we got 3,300. Well, actually last week we were allocated only 2,300 doses for the county. And we are the 3rd largest county in the state of Washington. So we did complain, we weighed in, and we were given another 1,000 doses that were brought over from, I believe, Island County Hospital there that could not get them out in time. So even 3,300 doses a week means if that was the allocation we got, it'd take us 5 years to get everybody vaccinated. So clearly that's not acceptable. Chair Wright, Vice Chair Dunn, and I sent a letter to the governor to really let him know, and there should be no ambiguity, that we had the ability to get more people vaccinated, and we had stood those facilities up, and our need is really just for more vaccine. So I guess last week also wasn't good news when we found out that the Federal Reserves that were being held back under the concept of having enough for a second dose, that those Federal Reserves actually didn't exist. So that's been a major disappointment over the last week, and we were hoping for an influx of supply from the federal government to the state and then out to us, but it doesn't look like that's imminent. So a disappointment there, but something we have to manage. So there was also a question about who's eligible and how you schedule. So typical to how the United States does business, we're a lot of separate entities. We have a whole private healthcare system and network with a lot of different providers who all function as separate entities. We have our public health, we have our first responders and others, emergency management teams. So it's rather a complex system, and each one of those different parts of it schedules its own vaccine. So the best advice we can give you to check if you're eligible, there's the Phase Finder website. You can get to that through the health district's website, and there's also scheduling ability through the health district for our 3 drive-through sites. But people that have private health care providers or insurance, or people in senior facilities or assisted living facilities, they just need to go through their healthcare provider to get that scheduled, because we do not have the ability to schedule for everybody, only our facility. So we're going to continue to advocate loudly, get more vaccine, make sure that we're ready. And I've told our team that we need to have the capacity to deliver every dose that we get. So our capacity to deliver needs to match or exceed the supply that we have, so there's no hiccup. If there's a bottleneck, you know, I don't want it to be in Snohomish County. So that's a high overview. We can come back for questions. I think, I don't know, is Jason, are you on?
Yeah, Dave,
okay.
I'm here.
So Jason Biermann is our Director of Emergency Management. Jason.
Thanks, Dave. Thanks, Chair Wright. Thanks to all the members of the Board of Health. I may have lost you all there. Heather, are you sharing your screen or am I sharing mine?
I'm trying to share mine. Hang on just a second.
Okay. I have this great presentation that Heather is going to manage for me. Technology.
All right, everybody should see this. You ready?
Great. Whoops. Yeah, so thanks again for a few minutes to update you and go into some of the details. And thanks, Executive Summers, and to the Board of Health for the support you've given us. And it is us. This team, the task force, the vaccine task force has been working together since late July. So it's been a team of a lot of agencies and a lot of hard work that's gone to get us to this point where we are now. And where we are right now is that we are ready to vaccinate residents. And quite frankly, we already have been for going on a couple of weeks. So we've got 3 sites, as Executive Summers mentioned, with the capacity to have several more. Our goal, as Executive Summers said, is to make sure that we can use vaccine as fast as it comes into the county. We've talked at length with our healthcare system partners about what they're able to do and what we can do to support them. So I believe our team has plans in place, and in some cases already has operations in place that are going to allow us to do that for the foreseeable future. We are prioritizing the folks who are most at risk. So I want to be clear. I know there have been a lot of reports that our pod points of distribution sites are first come, first served. That is not true. We're prioritizing based upon what the DOH and the state guidance is. But we do have challenges, and I'll go into those a little bit, most of which are outside of our control, but I think are important for you all to understand. Next slide, please. So the task force really focuses in 4 domains. First and foremost, to make sure that we coordinate all of the vaccine sites. We obviously have healthcare providers in the hospitals and the clinics and other locations that are providing vaccine. Our job is to support them, augment their efforts, and make sure that we can make as much vaccine available as quickly and safely as possible. We are focusing on vulnerable populations, the folks who are in marginalized communities, and as well as those that are in long-term care facilities, and those who've been hit hardest, like our phase 1A, the frontline healthcare responders. I've already talked about how we're trying to support the healthcare providers. Another piece of this is providing timely information. The folks in the Joint Information Center are providing things as quickly as we can. In some cases, we're not getting a lot of notice from some of our partners at the state, but they are working really hard to make sure that the current guidance is available and that we're communicating with the public as quickly as we can. Next slide, please. And I know that doesn't always feel like it's happening very quickly, but just again, I asked my folks to put this on just kind of as a point of reference. So vaccines just arrived here in mid-December. It's mid-January. We've already given, I think, I know over 14,000 vaccines in the county. We've already opened 3 separate sites throughout the county, in addition to what all of our partners, and right now there are about 50 or so different sites that are eligible in the county who've gone through the DOH process. So in a month's time, actually quite a lot's been done to get us to the point right now where we're actually administering vaccines to the phase 1B. And again, keep in mind that just opened today and we're already vaccinating folks who are in phase 1B1. Next slide, please. So how are we doing that? It's a multi-pronged approach. The medical providers and the pharmacies kind of speak for themselves. Our mass vaccination sites, we have 3 locations that are open right now. Our ultimate goal is to have, we're going to focus on 7 high throughput sites, 3 of which will be fixed, what I call fixed facilities, indoor facilities, 4 of which will be drive-through facilities. We are working with partners to identify the fixed facilities. Obviously the agreements aren't finalized, so I can't go into specific by name, but there are 3 centrally located facilities that provide high throughput and 4 drive-through facilities, 3 of which are already in place, 1 more of which will move to North County, and then ultimately we'll move one of the other current drive-up facilities to North County or further north in the county as well, so that we can provide full coverage to the county and provide accessibility to folks so they don't have to drive as far. The agile vaccine capability, our fire and EMS providers have been working really diligently with their community paramedics and working with some of their other teams on giving us a capability where we have mobile teams who have already gone out to long-term care facilities to provide vaccines on site. So that is already in place. There's a lot of communication happening with the Executive's Office of Social Justice and the fire and EMS community to coordinate places where we can actually do targeting. And I apologize for use of that word, but it's just targeting of marginalized populations so that we can get closer to them, similar to what we did with Nourishing Neighborhoods. We know where the most at-risk populations are, the ones who have mobility challenges, and we're working closely with them, the fire and EMS community, to make sure we can get a vaccine closer to those folks who may have issues with mobility and or economic disadvantage. So we may partner with the Nourishing Neighborhoods program. We may establish sites that are more along the lines of pop-up locations with some of the facilities that are closer to those populations, with the goal of getting the vaccine closer to those folks. And then next slide, please. All of that is a huge amount of work being done by a group of folks here, the task force, to coordinate all of that. I'd be remiss if I didn't mention, we've got partners on the private side as well. We are working with the clinics, the hospitals, fire and EMS, of course, Snohomish Health District, but even folks like our law enforcement community to ensure these places are safe. So there's a lot of work that goes into that. We do have some challenges. Right now, our demand from the public and our demand from our system far exceeds the doses that are available. We know that that's causing frustration, and I'm sure all of you are hearing it. I certainly am. I know others are. I just want to reiterate, we actually have right now with what we have available pretty immediately, we could readily get 20 to 30,000 doses of vaccine out per week. We have the ability with a couple of these large fixed facility sites that we're currently negotiating through agreements to add another 20,000 per week, which gets us to the 50,000 per week the executive mentioned. In addition to that, we would have the healthcare system. So we've got a pretty big demand signal, not a lot of supply right now. The institutional inertia, some of the processes that we are trying to navigate are processes put in place either by federal or state level agencies. It's becoming difficult. And again, I'm sure all of you are going through the same issues that we are with trying to communicate how different tiers have been established and why they're different from federal guidelines and why some of the requirements are in place that they are. That's caused us some challenges. We know on the third bullet, we know that some of our marginalized communities are very concerned, in some cases openly afraid of the vaccine and its safety or what perhaps some ulterior motives might be. We've been working really closely with both the health district and the Office of Social Justice to try and reach out to those communities to make sure that we can communicate with them in ways that they best receive about the safety of the vaccine and its availability. And then the misinformation and rumors. Obviously, there have been a lot of conflicting versions of what's happening with COVID-19 and what's happening with some of the mitigation measures and other things that have been put in place. That's been an ongoing issue, but one that we still continue to face now. Next slide, please. Just these last couple of things. Drive-through vaccination that's where we're working mostly right now. This is just to clarify. Again, these are by appointment only, even though it says drive-through. We are asking folks to have appointments when they come up, so it is not an open free-for-all. And we're not taking just anyone who drives up. And next slide, please.
There you go. And then tonight you might want to do a little warm pack. That helps. Okay.
Okay. Awesome. Thank you guys so much.
Okay. And the more you use it, the better. I one packed mine at night and it really helped a lot. Okay.
And you can click on the next slide, Heather, please. Yeah, that just gives you an idea of how quickly it goes. It's a very smooth process with pretty high throughput, the ability to expand, which is pretty cool. And it also keeps folks within their vehicle. So there's some automatic social distancing built into that. So I'm very honored to speak on behalf of the task force. I appreciate the time you gave me to go over some of the details of what we're doing. Happy to answer any questions when we get to that point, and thank you.
Chair Wright, could I add one thing?
Of course, go ahead.
Yeah, I just wanted to thank you as chair and all the hard work you've put in, and a special shout out also to Dr. Spitters and Sean Frederick for just the amazing work nonstop for the last year. It's a great team, and just wanted to thank you, and you all should be proud. And I want to thank the county council too. You know, we got $60 million from the federal government and had to decide how to spend it and allocate it and pump it out. And none of us have ever done this before. So it's just been a team effort. But Sean and Dr. Spitters at the health district, thank you. And your team also, Heather and all the others. It's been great. Thank you.
Dave, thank you for recognizing the team. They have been amazing. So thank you, Dave, or Executive Summers, pardon me.
Dave's fine.
So I believe at this point, Dr. Spitters, it's your turn. Well, we should check with the boss if Heather says that's okay.
Well, thank you, Chair Wright, and Executive Summers and Director Biermann, thank you for your ongoing support of all that you're doing related to the work that the Health District does, as well as all the branching impacts on society that you've been addressing throughout the pandemic. And Jason, in particular, on this, we're so grateful for your standing up of these sites and the plan for expansion. It's really been a heavy lift and a much appreciated augmentation of the control effort. So thank you. And Chair Wright, just to make sure I keep us on schedule, you know, we deferred the data update to this part. Do you want me to proceed with that, or shall I just cut forward to the vaccine part? Probably take me 5 or 10 minutes to do the data update and then move into the vaccine part.
I think a short data update would kind of set the table, and I think that would be beneficial for everybody.
Great. Happy to do it. Just didn't want to go down the wrong track here. So this is an oft-seen figure now in our world. This is the trend over time of the rate of reported COVID cases in Snohomish County. Each data point there, each number reflects the number of cases per 100,000 during the 14 days leading up to that specific date. And we recalculate that once a week and going back to the prior 14 days. So you see the first two bumps with our initial couple of waves, and then this large wave that had the onset in late September and took a notch down in late December. There's two things that could have been going on there. One is an actual reduction in transmission at some point in early to mid-December that led to a reduction in cases, and then a subsequent increase, i.e. Probably due to the holidays. Alternatively, the pre-holiday sociocultural environment might have been less conducive to people seeking testing when they needed to do so. So it's hard to sort out whether that decline was a surveillance artifact or a real dip in transmission. And here we are after another jump up from that little dip, and then in the last 2 weeks, again, a small decline from 418 down to 383 cases per 100,000 for 2 weeks. Very difficult to predict the future under any circumstances. not the least of which when there's unstable numbers like this. So we're really going to have to see how it pans out. Certainly all of our hope is that that initial signal we're seeing for the past couple of weeks will be sustained. And I think the important thing, if I don't mention it later, is that the vaccine is fundamental to our exit from this emergency that we're in, but it's not going to do it in the short run. And that's still going to be dependent on everyone's basic compliance with all of the social distancing, use of face coverings, and avoiding having gatherings. Next slide, please, Heather. So this slide just shows that the impact is felt across all age groups, but disproportionately younger adults. What this graph does is it takes the prior line and it breaks it into age groups that are delineated across the bottom there. And just to summarize, the upper 4 lines or so are individuals 20 to 59 years of age. Particularly our younger adults, 20 to 39, have really led the charge in terms of transmission during this current wave. And our older adults, 60 and up, are those lower curves, and a smaller number of individuals, fortunately, but given their smaller population, also higher rates in most cases. And then school-age children and school-aged adolescents are intermediate. And although we do see cases in kids, as this graph shows, we and occasionally see cases popping up in the schools that have done in-person learning. We're not seeing any sustained transmission in schools affecting staff or students. Occasional clusters, but things generally get wrapped up in the single-digit, small number cluster cases. The vast majority are just a single case in schools. Next slide. This just looks at cumulative rates. So throughout the whole pandemic, the cumulative rate, number of cases per 100,000 for each of our major racial and ethnic groups. And as you can see, the rates among American Indians and Alaska Natives taken together as a group are roughly double that of whites and Asians. African Americans about 2.5 times higher. Latinos roughly 3 times higher, a little bit over 3 times higher, and Native Hawaiian or Pacific Islanders quite a bit higher, a little bit more than I'd say 6 times higher there. And so that reflects largely, we think, exposure either through their participation in essential workforce duties that do not allow for adequate social distancing, as well as crowded housing, multi-generational households that tend to correlate with some of the socioeconomic indicators that also are unfavorable economic indicators that are associated with these groups. Okay, next slide. This just shows health district drive-through testing conducted at our sites, the major one at the Everett School District parking lot on Broadway, but also at the Linwood Food Bank out in Monroe. And we also have a site now at Everett Community College. We're getting about 5,000 tests done per week. And despite a little dip there during the holidays, hearkening back to my previous comments, dip in the number of tests and the proportion of positives, we are back up at about 5,000 tests per week, with roughly 10% of those being positive. Next slide. This just shows you where the cases have occurred. These are not rates. These are just shading of the map for the darkest, where the most number of cases have occurred. By and large, you see color and everywhere that people live in substantial numbers, and deeper colors where more people live. So there's no surprise there. And I think the key message of this is there's no populated substantially populated region of the county that has been untouched by COVID. It's really a society-wide phenomenon with some hotspots here and there. And certainly you see the bulk of activity over the long haul has been along the I-5 corridor from South Everett on down to the county line. Next slide. But this just shows you, now these are rates. This map shows you zip code specific case rates per 100,000 in the past 2 weeks. And this just shows a phenomenon that's been seen across the country, which is that earlier in the pandemic, the transmission, the highest rates were seen in the more densely populated areas of metropolitan areas. And then as time passes, it tends to move out. And this is an example, as you see, darker color indicates higher rate. And you can see that although most of our cases on the last slide occur along the I-5 corridor, we're seeing some of the higher rates now in more of the outlying, but still populated areas of the county. Next slide. Now looking at some of the impacts that we're trying to avoid through our prevention, education, the basic measures that all of us as individuals can take, but also the restrictions on social activity and commercial activity are really primarily, or I would say foremost, meant to preserve life, certainly, and but not the least of which is to protect acute hospital care capacity. And this slide just shows you the basically 2 big waves of hospitalization, one back with the initial problem we had back in last March and April. When case rates went back up again in the summer, you see a small bump during July, and then things came down, and then from the end of September on through the present have been steadily climbing with up to now 70 cases being hospitalized for COVID per week. And that the last week, 1 week period is a substantial drop, and often recent data on phenomena like this reflect incomplete ascertainment, incomplete counting of cases. So I would not take that low number of 38 there to heart. I think we still got ongoing hospitalization challenges. Looking at the next slide, this slide shows you a snapshot from Sunday afternoon, showing on the figure on the right, there are 3 lines. The gray line shows the number of confirmed COVID cases in Snohomish County hospitals at the moment. The blue line are the number of suspected cases with lab results pending. The orange line is the number of people on ventilators. And the grid on the left shows you the moment in time data for that instant on the 18th. So overall, over the last several weeks, the hospitals are running somewhere between 90 to 110 confirmed cases and 10 to 30 suspected cases. This particular day was a little bit high for reasons we can get into if there's further questions about it. But hospital capacity is challenged. They're over 90%. If you could go to the next slide. They're over 90% of total capacity, which is somewhat of a threshold for concern, but they're still functioning, operating, able to take the new admissions. And you can see that right now about 15% of people in the hospital are there for COVID. Also not listed here is the ICU occupancy. The number of proportion of ICU beds occupied as of today was 80%. So that is a favorable in that phenomenon in those who are hospitalized and have severe disease. There's currently capacity, but certainly the hospitals are stretched. And next slide, they're further stretched, not the least by this phenomenon. I showed you the slide showing the number of new admissions, and then the last slide was the census, the total number of people in the hospital. Well, driving that is the inflow, but also constrictions on the outflow. in part driven by this. These are cases arising out of long-term care, about 60% of which are residents and 40% of which are the staff. So those figures you see there have that split. Long-term care, though, long-term care residents account for about 25 to 30% of all hospitalizations for COVID and over 50% of deaths. So that's why they were prioritized for the early vaccination efforts, is to mitigate not only the suffering and death that our elders are experiencing in these settings, but also to try to forestall any further worsening of the hospital situation. But exacerbating that is that these skilled nursing facilities and other long-term care facilities, once they have a cluster of cases brewing, it becomes difficult for them to readmit or to take admissions from the hospitals. So that's causing many patients who are in the hospital to kind of take up space waiting for placement somewhere. They're not well enough to go home. They need to go back to their long-term care facility or be placed in one, at least temporarily. And yet there's a slowdown in that process because of the impact of COVID on long-term care. So it's a double-edged challenge for the hospitals right now. Next slide. This just shows you COVID deaths over time. We're at a total of 450 approximately deaths of the 27,000 cases. So roughly 2% of confirmed cases, confirmed reported cases culminate in death. We see that increasing up through December, then declining. And I think time will just tell. Hopefully that's a sustained signal, although the sustained increases in cases and hospitalizations makes me think that a couple weeks down the line from what we're seeing right now, we might indeed see more deaths emerging. Having said that, given the improvements in clinical care that occur, you know, even if you are hospitalized or end up in the emergency or in the intensive care unit, the probability of survival has increased over the course of the pandemic. Next slide. So now turning to our what used to be the Safe Start framework and now is the governor's roadmap to recovery, and the updated metrics that we're looking at and monitoring and using to index our future forward movement in social interaction and commerce. Snohomish County has been grouped with King and Pierce counties as the central or Puget Sound region, and we move in sync with that region forward or back based on these criteria. Next slide, please. And those criteria are slightly modified from what you have seen in the past. So I'm going to go over those briefly. Same principle though. We're looking at how much COVID activity is in the area, how much transmission is occurring as reflected by case reports, what the test positivity rate is in the community, and then what the healthcare system capacity is. So the current metrics, this one hasn't changed. The first one is the 14-day rate. I've shown you that. As of now, the state runs these figures on time periods that are slightly different than our most current data in circumstances where the data is not complete. So this is a little bit behind the current moment, but through December 19, Snohomish County and through the region, things were declining substantially, exceeding that 10% decline needed to be considered to move ahead. Testing positivity, skipping to the bottom of the slide, had declined to 6%, although we think that was an artifact somewhat of decreased testing overall, but also maybe people having travel or holiday gathering related testing, wanting to get a negative test, even though they weren't pursuing it for an illness. And so that was down, but that too will be up as we see. Those are older dates. Our current dates were up above 10%. And then two other factors, the trend, be it flat, up, or down, in new hospital admissions over the preceding 2 weeks, as well as the average occupancy over the prior 7-day period for the ICUs. So at this time, we were improving on all 4 metrics. Subsequent to that, our case rate went up, our positivity rate went up, and we are not eligible for movement beyond phase 1 and may not be for a few weeks to come, but we continue to work on it and remain hopeful of moving forward. The vaccine endeavor will help us in the long run toward that, but in the short run, we need people to continue doing all those things we've been asking all along related to masking, social distancing, and avoiding gatherings. Next slide. So in summary, the reported case rate has resumed an upward trajectory, at least through 2 weeks ago, and then the last week, a little bit of a decline, but overall, we're at a high level of transmission, and that's probably in part related to winter holiday related factors. Positivity rate on Snohomish Health District testing remains above the state's threshold for moving forward of 10%. The acute healthcare system remains stressed, but is managing, but the high census is a challenge, as are the barriers to discharge for patients needing long-term care. And those long-term care outbreaks exacerbate that, and hospitalizations and deaths all continue to be a dominating feature connected to long-term care, again, highlighting the importance of our efforts to get the staff and residents there vaccinated. The recent declines in some of these indices may rebound for the worse, given our more recent increases in the case rate. The health district workload on this remains very high, particularly around case investigations, contact tracing, contact quarantine, and then outbreak investigations related to both long-term care and other employment settings. We're having to triage and prioritize our efforts to where the limited resources will do the most good, and our staff's been doing a great job at that. And then I just wanted to touch on this new variant strain that appeared in the last couple of weeks in the United Kingdom. And further scientific work does indeed suggest it's probably a bit more transmissible than the prevailing strains circulating in the globe. On average, contacts of this virus strain get infected about 15% of the time, as opposed to about 10% of the time with the other prevailing strains. And the Centers for Disease Control and Prevention predicts that this strain will displace currently circulating strains within a few months as a result of that higher transmissibility. It's currently less than 0.5% of studied strains in the United States, but that's likely to expand. The impact on the ability to diagnose the infection is marginal, as is the impact on immunity and gained by vaccination. We don't think that this new strain will evade the immune system's response to the vaccine. However, because it's more transmissible and can lead to more cases, it could have a negative impact on hospitalizations and deaths simply based on increased transmissibility, further underscoring the importance of our ongoing existing mitigation measures and the importance of a thorough uptake and speedy process for the vaccination effort. So as we look forward, we're moving through the vaccines, and we've completed, I wouldn't say we've completed, but kind of reached diminishing returns on vaccinating clinicians and other high-risk staff in healthcare settings, as well as first responders. And then there's a separate but equally important, arguably more important effort going on with a a partnership between the federal government and 2 commercial pharmacies, CVS and Walgreens, to vaccinate residents and staff in skilled nursing facilities as well as assisted living facilities in Snohomish County and throughout the nation. That program was getting its toes wet in December and now is moving ahead, but we currently don't have quantitative visibility of progress being made. The state is working on that for us, but meanwhile, we continue to hear anecdotes of facilities we interact with either having had their first day or getting scheduled. So that opened it up to phase B1, which is individuals 65 years and up, as well as those who are 50 years and older, living in a household with multiple generations. Our estimate is that approximately 150,000 people are now eligible in that group. 120,000 of those are the ones 65 years and up. And then we're estimating that approximately 20% of people 50 years and older live in a household with these qualifying and have these qualifying factors. So it's not just being over age 50 and having another generation in the house. There's actually more to it. You have to be over the age of 50, the potential vaccinee over 50, not able to live independently, and either receiving in-home care from a paid or unpaid caregiver who comes into the home, or living with someone who works outside the home. People who are over the age of 50 and living with and caring for a grandchild also are included. But excluded from this are people like my household, where my spouse, my wife's, eligible based on age, and we're living with our stepson, or my stepson. So that's 2 generations, and she's over 50, but that's not enough. You've really got to meet those higher criteria up above there. Next slide. So this just shows the statewide rollout of vaccine doses administered, and up through the 13th of January, over 235,000 doses administered. I believe that's based on about 600,000 doses distributed. So, roughly, about 40% administered statewide. Next slide. When we look at Snohomish County, you can see we've gotten about 41 or 40,000, using round figures, 40,000 of the 600,000 doses that went out statewide, or about 7%. And we've gotten about 26,000 of those, or that's going to be roughly, 65% into people's arms. So we're doing better than the state on proportion of doses administered, not as well on actually getting the allocations. I think Executive Summers addressed that, and we'll continue to work on that. One thing to keep in mind, just for perspective, is that those first allocations were largely based on the 1A, the estimated population of 1A healthcare workers in various communities. And our neighbors to the south have a much larger healthcare community, so they got a little bigger allocation. But hopefully over time, our allocations will more and more reflect just our proportion of the statewide population, and we'll continue to do well in getting those doses out. Another thing about, even 65% administered might be disappointing to some, but things to keep in mind too is that there are people awaiting a second dose who some of the vaccine providers were holding back supply for. And so that's part of the sort of the inventoried vaccine that has not been administered. And I think that's the key thing. But also, as these facilities reach diminishing returns on the 1A group, not being able to open up into 1B was kind of holding them back. So we're greatly relieved to see that opened up. And we think that reserve vaccine supply will be put into arms in short order. Next slide. So a couple of comments about the prioritization. It can be off-putting to see or to not see yourself or members of your family or community covered in the early phases. And this prioritization scheme is not at all about society's, governments or public health evaluation of the individuals or groups addressed or not addressed. It's really about optimizing a balance between societal benefit, namely preserving hospital capacity, preventing death, so focusing on high groups at highest risk of severe outcomes, and then also some cross-cutting equity and fairness issues. But our first order of business, at least from my perspective as a health officer, is to diffuse the threat of an overwhelming hospital surge. And so that's why the 1A has gone out in the order it did, those groups. And that's why our older adults are being prioritized categorically in phase 1B1. And other elements of society, including some essential functions of society, are being deferred, because right now what we really need to do is address the threat of the hospital surge among those who have the higher risk of complications or death, rather than their risk of transmission or their occupational role in society. Next slide. So in summary, or in closing, I think it's a good idea for all of us to know where we're at in terms of our eligibility. And there's a website put up by the state, findyourphasewa.org, and it asks a series of questions about your, age, health, and occupation. And it will tell you whether you're currently eligible under 1A or 1B1. And then if you aren't, it will prompt you to give an email address or a text so that you can be notified when your class comes up for vaccination. We discourage folks from trying to jump the line. Again, if we're successful in jumping the line, that means we've probably pushed someone who was independently viewed as higher priority down in the list. And so that's not some behavior we want to promote. So if you hear of a place with vaccines, please let people who are eligible know. And when it's time to get your vaccine, register, keep your appointment, get vaccinated. And in the meantime, please have patience for us. Know that we and our partners are working hard to try to move this ahead, but it's going to take a while, even at the 20 to 30,000 doses a week that Director Biermann was forecasting, or the ultimate goal of 50,000 a week. It's going to take a long time to get through 800,000 residents. So, this is a many months process, and we really need to keep our heads about us and be patient. And in the meantime, keep wearing those face coverings, washing our hands, social distancing, avoiding gatherings, and we look forward to that vaccine supply picking up, and both at the manufacturing level and then as it flows through to our state and on down to us as a county, and having better visibility on that so that our vaccination providers and the Department of Emergency Management sites can plan better and set up the appointment slots to reflect the forthcoming vaccine supply. And then we'll just continue to partner with the county on outreach to hard to reach and underserved populations along the lines that Director Biermann mentioned. So with that, I'd like to thank you for all your support and time listening to us, and turn it back over to Chair Wright.
Thank you so much, Dr. Spitters. Well, Heather has been receiving some questions through the chat box, so I'm going to turn it over to Heather Thomas to go through a few of the questions we've received in the time that we have left.
Sure. I think a few of these Dr. Spitters has addressed. There was a question either for Dr. Spitters or for Jason. For the drive-through sites, do we know when they'll release new dates? Do we know, will it be on a Friday, knowing what the plan is coming ahead? Do either one of you want to speak to that?
Yeah, I can speak to that. So it depends on vaccine availability. We had to make a decision about how far out to let the scheduling go, and we didn't want it to go too far so folks wouldn't schedule something out and then get disappointed when we had to send out a lot of emails saying, or text messages saying that we had to cancel the clinics or the drive up locations because of lack of availability. So when the new allocation comes out, we'll evaluate how often or how long we can keep the clinics open, and then we'll send out and let people start scheduling based on that.
Do we know when the new allocation will come out?
The sort of the LHJ's ability to provide comment ended today at noon. So I think by tomorrow we should have an idea of what the allocation will be for the following week. So we're 1 week, keep in mind, we're 1 week behind.
And that's all the questions I had in the chat. And I think all the other questions have been answered.
Excellent. Thank you, Heather. And I'd just like to thank all of our speakers, Executive Summers, Director Biermann, and Dr. Spitters. Thank you so much for being willing to join us today and give everybody an update and keep everybody wrapped up with the most current information. So very, very much appreciated. So this is the official end of our health board meeting. So I just want to mention a couple upcoming meetings before we adjourn. Our policy board will meet on the 21st at 3 p.m. Our FAC will meet on the 27th at 7:45 a.m. Administrative Committee, 27th at 3:30, and the Executive Board, the 28th at 1:30. And our next Board of Health will be February 9th at 3 p.m. So again, I'd just like to thank the Board of Health, all of our staff, all of the city partners, state partners, everybody that joined us this evening. We just want to make sure that we keep everybody informed and that we're all on the same page and working together. So thank you so much, and enjoy your evenings. Take care.
Thank you, Chair Wright.
Thank you, guys.